New hope for those living with paralysis. Nerve stimulation therapy could allow patients to regain arm function. A spinal cord injury is a serious medical condition that occurs when there is damage to the spinal cord, the central structure of the nervous system that runs from the brain down the back. This damage can result in a loss of movement, sensation, and other bodily functions below the site of the injury. A promising nerve stimulation therapy has been developed at Columbia University's Vagelos College of Physicians and Surgeons, which has shown positive results in animal studies. This therapy has the potential to restore arm function in individuals with spinal cord injuries, offering a new hope for those affected by this debilitating condition. The stimulation technique targets the nervous system connections spared by injury, says Jason Carmel, MD, PhD, a neurologist at Columbia University and New York Presbyterian who is leading the research, enabling them to take over some of the lost function. The findings were recently published in the journal Brain. In recent years, some high-profile studies of spinal cord electrical stimulation have allowed a few people with incomplete paralysis to begin to stand and take steps again. Carmel's approach is different because it targets the arm and hand and because it pairs brain and spinal cord stimulation, with electrical stimulation of the brain followed by stimulation of the spinal cord. When the two signals converge at the level of the spinal cord, within about 10 milliseconds of each other, we get the strongest effect, he says, and the combination appears to enable the remaining connections in the spinal cord to take control. In his latest study, Carmel tested his technique, called spinal cord associative plasticity, SCAP, on rats with moderate spinal cord injuries. 10 days after injury, the rats were randomized to receive 30 minutes of SCAP for 10 days or sham stimulation. At the end of the study period, rats that received SCAP targeted to their arms were significantly better at handling food, compared to those in the control group, and had near normal reflexes. The improvements in both function and physiology persisted for as long as they were measured, up to 50 days, Carmel says. Many spinal cord stimulation studies focus on walking, but if you ask people with cervical spinal cord injury, which is the majority, what movement they want to get back, they say hand and arm function, Carmel says. Hand and arm function allows people to be more independent, like moving from a bed to a wheelchair or dressing and feeding themselves. Carmel is now testing SCAP on spinal cord injury patients at Columbia, Weill Cornell, and the VA Bronx healthcare system in a clinical trial sponsored by the National Institute of Neurological Disorders and Stroke. Looking further ahead, the researchers think that the approach could be used to improve movement and sensation in patients with lower body paralysis.